Monkeypox is a viral infection. We're hearing a lot more about it because now it's being spread worldwide. It's being spread from person to person, from someone who has this viral infection to other people who are vulnerable. It is here in Monterey County. We have, as of the making of this video, 4 cases of monkeypox in Monterey County residents. We also know that there are a larger number of people diagnosed with monkeypox infection in the San Francisco Bay Area. So this infection is here locally, and it is spreading within just a very small subset of people. So this infection is spread from person to person, but it is not spread generally by coughing or air. Right now, this infection is spreading mostly in the community of men who have sex with men. The viral infection is spread when there is direct contact with skin that has one of the monkeypox rash lesions. So some of the first symptoms of monkeypox are pretty generic. They can be a flu-like illness. People feel feverish, they may feel chills, they may feel body aches. This is why we call it a flu-like illness, because those symptoms are very generic. However, following that flu-like illness, people develop a rash, and the rash is very specific for monkeypox. The rash that you need to be concerned about is something that looks very much like chickenpox, which I think a lot of people are familiar with. The chickenpox rash is blisters that develop and then fill with some cloudy liquid that looks like pus. These blister-like lesions are very tender and painful. They don't tend to be itchy, but they can be. They are developing on the skin at the site where there was skin-to-skin contact with another infected person. So generally, they are developing first on the genitals and on hands. So that's very typical for the monkeypox rashes that we're seeing now. People are wanting to know what they can do to prevent getting monkeypox and what they can do to keep themselves safe. The most important thing is educating yourself, knowing what to look out for and knowing when to seek some medical attention. Knowing how you can get it is also very important. So for men who have sex with men, it's important to contact a medical provider if you have those symptoms, flu-like illness followed by the typical rash. For other people, if they develop an unknown or an unusual rash that they may be concerned could be monkeypox, I do recommend discussing it with your primary care doctor to have someone look at it, particularly if it has those characteristics where it's very tender or in a place where you may have had skin-to-skin contact with another person who's infected with monkeypox. So there are a lot of people who are hearing a lot about monkeypox and may be concerned that they've been exposed or may have symptoms that they want to get checked out and find out if it really is monkeypox. Right now, our health department is making a big effort to contact people who have been directly exposed by someone else who has monkeypox. So in many cases, people will be notified by public health authorities if they've been exposed. Now, if you're unsure if you've been exposed and you have developed those symptoms, I do recommend contacting a primary care provider or seeking an evaluation at a local urgent care if you have a suspicious rash and are concerned that you could be having monkeypox. So although there are some similarities with chickenpox, like I described, the rash can look similar. Unfortunately, having had chickenpox or having been vaccinated against chickenpox will not protect you against acquiring monkeypox. So there is a vaccine that is available for monkeypox. Right now, it is only available in limited quantities, so our local, state, and federal health authorities are helping us distribute that vaccine to the most highest risk patients, so those who have been exposed or are likely to be exposed. It is not available to the general public at the current time. There is treatment for monkeypox. However, the vast majority of people that do get monkeypox don't require any specific treatment for it other than symptom treatment, and it is very, very rarely, if ever, fatal. So good news, we can prevent it with vaccination, it is treatable, and almost never causes anyone death.